It's a real pleasure to be here to see through some work from Tom Buchanan and the rest of the Sun Life team. I know it started a number of years ago, creating an opportunity to support the foundation, and so we're thrilled now to be a part of this. Sun Life has been a wonderful corporate sponsor with a number of initiatives as it relates to helping Canadians with their health, and specifically those who are suffering from diabetes. It's a disease that we've chosen as one of our philanthropic desires to help rid Canada of that disease. We are doing that because of the wide breadth in which it covers. There's nearly 9 million Canadians are covered or challenged with either pre-diabetes or diabetes itself, and so you don't stretch too far to say that we're all affected, and that there's likely somebody that we know very closely who's having a challenge with that disease. So we're thrilled to be a part of the foundation and bringing together the 3 hospitals with a donation. We're also thrilled to have our name on the location where families will be coordinating some help, and to also be associated with a dialysis machine that will in part help many Canadians suffering from diabetes. So to the Kingston General Hospital, it's our pleasure on behalf of Sun Life to give you $100,000.
2010, a small group of patients and staff came together to create PFAC, or Patient Family Advisory Council, at KGH. And Glenn and I were lucky enough to be among its founding members. Daryl approached us and we said, yes, rather than complain, we'll help. We wanted to improve the care and safety, the well-being of patients and staff in this hospital by bringing the patient's perspective and the family's perspective directly into planning, delivery of care, and evaluation of our hospital on a continuous basis. The 4 concepts of patient family-centered care are the following: dignity, respect, sharing of information, participation, and collaboration. Patient family-centered care is about working with people in partnership.
I became a patient experience advisor in May of 2010, and I've really enjoyed this role. I spent a lot of time in hospital, and over the last 14 years, it's like my second home. In fact, my family thinks you should have my own room here, with just my name over the top of it, because we're here so much. So I do get to experience what changes that I can see happening and share them with the team, the advisory committee. And I'm probably the only one on the committee that is in and out of the hospital, so I can constantly evaluate what's going on and identify some of the critical areas. Over the last years, and it's been 14 years when I've been in and out of the hospital, I've noticed some really significant changes, which really have started since the advisory council came into play. And I can tell you some horror stories of things that happened to me prior to those days. And I'm really pleased to report that those kinds of things aren't happening anymore. And I've seen some significant changes.
To me, this is actually a very significant event, because it's a very significant gift to our organization. And I think you've heard about the KGH commitment to transforming patient experience. And some of the accounts that Andale and Glenn have shared are messages that we've given into our organization, and definitely are ones that have been heard by our board. And I know that Tom, as a member of our board, heard those and really heard them for the value of what it was doing to this organization. And I think it's through that actually this gift has become possible. What Glenn and Andale have described doesn't just happen magically. It has come about because of individuals within the organization being very committed to what patient family-centered care means, what patient engagement is about, and how that actually drives change within the organization. And it came about actually first by Daryl and one of our other members of staff going to a conference in the States and hearing about the work and beginning a relationship with some very treasured colleagues who are in Georgia. And that actually became part of the journey of KGH. And through that, we began to say, how can we garner off a few dollars and how can we save enough to be able to support other staff going? And so twice a year, we have been sending staff to institutes where they can actually hear from other experts around the world about what patient engagement is about, hear new ideas of things that can be done that truly begin to transform the patient experience, and bring those back to our organization. So it's that opportunity for learning and going away and learning that really begins to say that's how you energize an organization and begin that cultural shift. It's only through knowledge exchange and education and then putting that into use.
Thanks everyone for being here today. On behalf of the UHK Board of Directors, I really sincerely want to thank Sun Life for such a generous donation. Health is the #1 priority for all of us, and most generous support will help make the extra difference in the individuals who receive care here and their families. The work that you are enabling, harnessing through together with the energy, commitment, and passion of patient experience advisors like Annadelle and Glenn will result in a very positive thing for patients and their families. And again, thank you so much, Glenn and Annabelle, for both your stories. As UHKF shares a similar logo to that of Sun Life, we've got strength, warmth, and light in common. I think we both agree life's better under the sun. So again, Sun Life, thank you very much, and everyone else for being here. Thank you.